Hi everyone, my name is Danielle DeWash. I'm a family nurse practitioner. Today we're going to be talking about the flu. Each time I talk about the flu, to me it's upsetting. Here's the reason why. Approximately 1 billion individuals infected by the virus. 3 to 5 million cases of severe illness. 500,000 dies nationwide from that virus. If we are looking the mode of transmission, you'll tell me if this is not preventable. Let's look at the mode of transmission. Sneezing, coughing, breathing, contaminated surfaces that is contaminated with the flu. So tell me, if you cough, you know you are sick. Even though if you know you're not sick, you need to cover your mouth. If you sneeze, you can use the elbow sneeze technique. And if you use a tissue after you cough or you blow your nose, you need to discard it. And then you need to wash your hands if water and soaps are available. If it's not, you can use a alcohol-based hand rub, and then you use friction and then to eliminate that virus from your hands. And when you wash your hands, you don't get your hands wet and then you're done. You have to use soap and water and use friction, which is you rub your hands together. And after you're done washing your hands, you need to use a clean paper towel to turn off that faucet. You do not touch that faucet with a dirty hands, because you're going to get that virus back into your hands and you're going to spread that around. And then now you're going to cause a lot of people to get sick and then die. And then they're going to be part of the statistics. So now, what do we know about somebody who probably might have the flu? What are the signs and symptoms? Okay, fever, chills, headache, severe muscle aches, malaise, and anorexia, meaning lack of appetite or loss of appetite. But mostly the headache, muscle aches, fever, that determine the severity of the disease. But let's look at the group that are at high risk to develop complications from the flu. People at age extreme, meaning the very young and the very old, especially if they are unvaccinated, and immunocompromised people, such as cancer patients, HIV positive people, or people who are taking steroids, or who are in long-term aspirin. They can develop complications from that virus. People who got chronic lung disease, people who have, for example, chronic renal diseases, people who got transplant, they can develop complications that can be deadly from the virus. Let's look at complications of influenza. Pneumonia is one of them. That is pulmonary related. But there are also non-pulmonary related complications, such as endocarditis. It's an infection in your heart. It can be meningitis. It will affect your tendons, your ligaments, your muscles, and your bones. So a little bit of prevention can come a long way to prevent people from getting sick and die. How do we treat? Really, honestly, we don't really treat. We just prevent and shorten the duration of the flu when you have it. The medication we usually use is Tamiflu, and also known by oseltamivir. It's 75 milligrams that your doctor or your provider, your nurse practitioner like me, can provide you, can prescribe you to take twice a day for 5 days. And also we can prescribe it to you as a preventative measure if you are at high risk. We can prescribe it to you 75 milligrams. You can take it once a day for 7 days. But also there's an inhalation of the medication also you can take. It's called zanamivir. And it's an inhaler, it's 10 milligrams, and then you inhale it for 7 days. And that can also help you. But don't forget that you have to prevent that disease from spreading. Wash your hands very frequently and using friction. And also you have to keep yourself well rehydrated so you don't get dehydrated. You can use Tylenol or ibuprofen if it's not contraindicated. If all of what you do and then you don't have any good results, now that's the time for you to call 911 and then to go to the hospital so you can get IV fluids and so you can see what's going on, why the fever does not go away. If it doesn't go away, probably you become septic. So we need to take further interventions for that. But you can also use some natural remedies also. How do you do that? But you have to talk to your healthcare providers before you take any herbal medications or any new medications. Not because something is herbal, they don't have side effects, but you are wrong. They do have side effects. Not because something said FDA approved, it's safe to take, is no side effect. No, that is not true at all. You can take vitamin C, which is you can take 1,000 to 2,000 milligrams daily. Not only it boosts your immune system, it is good for allergy. There's a medication called quercetin. You can take 500 milligrams. You can take it once daily. All depend on the severity of your mucus. If you are exerting a lot of secretions, you can take it 3 times a day. But you have to be careful because this medication dry up your mucous membrane. It's gonna give you headaches. So you have to be careful. So always talk to your healthcare provider before you take any new medications. If you are exhibiting for some time some kind of nausea, you can take ginger capsules, 250 milligrams. You can take it 3 times a day as needed. But however, if you have history of bleeding, you cannot form any clots, blood clots, and then you are on aspirin, Coumadin, or the like, you need to be careful and talk to a health provider. You don't go and take medications like that. And then if you are exhibiting, for example, sign of indigestion, papaya chewable, you can use that for indigestion. And if you cannot sleep, you can take melatonin, 3 milligrams, either by mouth every night, or you can take it sublingual, which is you put it under your tongue. And magnesium sulfate, you can take magnesium sulfate, 250 milligrams to 500 milligrams. You can take it. It's what it does. It relaxes your muscles, and then it helps you to sleep. Epsom salt, if you have muscle aches, you can put Epsom salt in warm water and you soak. And that also will help you sleep at night, and then it helps with the body aches. What's in the Epsom salt? Magnesium sulfate is on it as well. And if you have sore throat, you can use warm gargle salt water, or you can use lozenges, zinc lozenges, especially the one that at least 5 milligrams. You can start off when you go and you read the label, and then you can go from there. You can also drink plenty of fluid. There's nothing wrong with that, except if you have congestive heart failure and you have a history of low potassium. So we don't want enough potassium. If you have some low sodium, then you cannot take a lot of water. You have to talk to a healthcare provider because you don't want to deplete your sodium levels, and then you can have seizures, you can have headaches, and then the outcome won't be great for you. But you need to talk to a healthcare provider. And that's all I have for you for today. But remember the signs and symptoms of the flu. Remember how you can get the flu. Remember how to prevent it from happening. And especially remember how many people you could have saved by using good, proper hand hygiene, by protecting yourself while you're protecting other people. Remember to follow me on social media. And also, don't forget to subscribe on my YouTube channel. And all the information will be available to you either to my website, dmchealth.care, or on YouTube channel. Follow me. But most importantly, follow Christ. Remember, your body is the temple of Jesus Christ. Keep great care of it. Have a wonderful day today. Bye-bye.